The first industrial revolution in England, which lasted roughly from 1750 to 1850, laid the groundwork for the modern world. Increased textile output, steam and coal power, and improved metallurgy all contributed to significant economic growth and a population explosion in the United Kingdom during this period. Later in the 19th century, it extended to the United States, altering both society and commerce. However, there was a darker side to the Industrial Revolution that was transferred across the pond. Horrible working conditions, slum dwellings, rampant disease, and a lack of government intervention. There were no hygiene or health practices guidelines. Medical care was unavailable to individuals who could not pay for it. Factory life was a living misery, and city streets were clogged with trash. It was a difficult period to be a working-class person. Today, we're going to take a look at the gross story about the gruesome hygiene of the Industrial Revolution. But before we get started, be sure to subscribe to our channel and hit the bell icon so you don't miss out on any videos. Pour yourself a large cup of sewage river water. We're jumping right in. One writer likened the air quality to swallowing a pound of cayenne pepper. George Wirth, a German writer, portrays a horrifying situation for Englishmen in 1846. In Manchester, the air lies like lead upon you. In Birmingham, it is just as if you were sitting with your nose in a stovepipe. In Leeds, you have to cough with the dust and the stink as if you had swallowed a pound of cayenne pepper in one go. But you can put up with all that. In Bradford, however, you think you have been lodged with the devil incarnate. If anyone wants to feel how a poor sinner is tormented in purgatory, let him travel to Bradford. Wirth spent 3 years in Bradford, a significant industry town during the Industrial Revolution. He expressed his displeasure with the living circumstances of local laborers to fellow revolutionary theorist Karl Marx and Friedrich Engels. Because of the smoke, the average longevity in Bradford was just 25 to 30 years at the time. While manufacturing owners and upper-class people could escape the city's pollution, employees lacked the financial means to do so. Many laborers succumbed to their disease in their mid-20s. Today, the average life expectancy in the United Kingdom is 79 years for males and nearly 83 for women. English manufacturing employees were lucky to live to the age of 30 in the Industrial Revolution. Laborers were exposed to disease and chemicals at a higher rate than their middle-class colleagues, who typically lived to the age of 45. The disease spreads from person to person as well as from water sources to humans. Infection rates were highest in densely populated cities and slums. One sanitary report described the appearance of the impoverished as wretched and neglected. In 1842, British sanitation advocate Edwin Chadwick published a paper titled Report on the Sanitary Conditions of the Laboring Population of Great Britain. Chadwick describes the poverty, filth, and filthy conditions that most working-class people were subjected to at the time. As he describes what he sees in one town, the cottages in the neighborhood were the most wretched kind, mere hovels, built of rough stones and covered with ragged thatch. The wife's face was dirty and her tangled hair hung over her eyes. Her cap was ill-washed and slovenly put on. Her whole dress was very untidy and looked dirty and slatternly. Everything about her seemed wretched and neglected, and she seemed very discontented. Chadwick has demonstrated the link between these living conditions and the transmission of infectious diseases throughout these communities. Unfortunately, these areas remained breeding grounds for disease and its spread. Cholera, typhoid, and typhus were rampant due to a lack of public sanitation. There were well-documented epidemics of cholera, typhoid, and typhus that impacted industrial Britain's most vulnerable communities. England saw 4 cholera outbreaks in the 19th century. Cholera is a bacterial infection that causes severe gastrointestinal problems and dehydration, and it often kills people. The disease originated in the Indian subcontinent and spread to Europe. Due to a lack of infrastructure to segregate sewage water from drinking water, it spread quickly. It earned the moniker King Cholera due to the large number of individuals it infected. Approximately 15,000 people were killed in London during the 1848 to 1849 uprising. Typhoid and typhus were 2 more diseases that afflicted industrial England. Typhoid thrived in water sources, particularly wells, at the time, causing flu-like symptoms. Typhus was discovered in lice, which were common in densely populated tenements and shared living places. The only available water sources were heavily contaminated. Most drinking water in England came from rivers during and after the Industrial Revolution. human waste was discarded in the streets. Cities in England were constructed around manufacturing and space was limited. Housing complexes were built on top of one another and lacked numerous modern conveniences that are now typical in any housing arrangement. Workers in these cities spilled their garbage into the city streets since they lacked modern plumbing and latrines. Alternatively, many structures had underground cesspools where sewage accumulated. Their contents frequently overflowed and spilled onto the streets. These procedures were common throughout the Industrial Revolution since it had not been scientifically demonstrated that hazardous bacteria reside in feces. The first British Public Health Act was not passed until 1848. The first Public Health Act was passed in 1848, 6 years after Edwin Chadwick issued his report on working-class sanitation. Chadwick suggested this law to save the British government money by reducing the poor's reliance on government grants and services. Many households required government aid after losing family members to contagious diseases such as cholera. For a long period, the administration ignored Chadwick's recommendations. It wasn't until another cholera outbreak in 1848 that the government passed the act, which established a structure for municipalities to have medical physicians, adequate drainage, waste disposal, and safe drinking water. However, there was insufficient funding and no control to ensure that these frameworks were applied. Doctors of the era concluded that disease spread through bad smells. The concept that disease spreads by foul scents, known as the miasma theory, dates back from the Middle Ages. By the 19th century, the notion had spread throughout England. Instead of focusing on poor sanitation, doctors concentrated on the foul-smelling air itself. Edwin Chadwick, who again wrote some of the most important sanitation studies and regulations, also believed in this theory. Under his direction, garbage was tossed into the Thames River to reduce the aromas that polluted London streets. If the goal was to eliminate foul scents, it failed terribly. Following centuries of trash disposal into the river, a particularly hot summer resulted in the Great Stink of 1858. The unpleasant odor of pollution eventually forced the government to implement large public works projects, including the construction of a functional sewage system. Overcrowded tenements were breeding grounds for smallpox. The smallpox virus is highly contagious and creates rashes and scabs that can be lethal if not treated properly. Although Dr. Edward Jenner developed an effective vaccination for the virus in 1796, city workers were oblivious, and the medical community did nothing to reach out to factory workers and their families. The crowded tenement environment was ideal for smallpox to spread from person to person. Without the necessary expertise or resources to combat the virus, it spread like wildfire across the densely packed industrial apartment complexes. Contraceptives were only available under the counter. Intercourse was a taboo subject in 18th and 19th century England, and the majority of sexually active people had no access to birth control. Condoms did exist, but they were only available to those who could find them and pay for them. Childbirth was also a dangerous experience for women. Maternal death rates were estimated to be 7.5 per 1,000 women between 1750 and 1800, and 5 per 1,000 women between 1800 and 1850. More people meant less room, which resulted in tighter quarters, more slums, and poorer sanitary living conditions. Without contraception, sexually transmitted illnesses spread quickly. Please give your thanks to Durex and Purell. So what do you think of the Industrial Revolution? Let us know your thoughts in the comment section below.